As we get older, our bodies begin to feel the effects of years of exercise, hard work and play. In addition to wear and tear, joints can also be affected by diseases such as arthritis. The final result is often debilitating and painful. Joint replacement surgery for your hip or knee can relieve these symptoms and extend your ability to participate in physical activity. Patricia needs a total right knee replacement. Bob needs a total left hip replacement. Both are about to go through the same pre-operative procedure prior to joint replacement surgery. Bob's journey begins with his first visit to his surgeon.
You reach the stage where your arthritis now is troubling you quite significantly and nothing seems to be helping.
No.
I think it's time to consider hip replacement surgery. When we do the hip replacement, we open up the joint. This is your thigh bone. It forms a ball at the top end and it sits inside a socket. Normally the ball moves very smoothly, and the reason why it moves very smoothly is because there's a layer of cartilage on the surface. Now that's all worn away and you've got bone grinding on bone. So it's time to think about replacing those components because we cannot replace cartilage. When we do the surgery, we make an incision on the back of your leg. We dislocate the joint, we cut the bone across there and we take the ball away.
Oh really? Okay.
And we replace it with a component that looks a bit like this. We make a little channel inside the bone and we seat this inside the bone all the way down until it sits firmly, and generally glue it in place.
Right.
And it sets firmly in that place. On the other side, we got a component that looks like a cup to match the cup that you got in there. The cup's made of steel. Right. It's got generally a couple of screws which you may or may not use. So we open up the cup and we put this into the socket deeply and lock it in place by putting some screws in place.
I see.
And the bone will grow into the surface along here.
Okay.
So when it's all together, we articulate the two pieces together and that forms your artificial hip joint.
The Whitlam Joint Replacement Centre, located at Fairfield Hospital, provides joint replacement surgery for the southwest Sydney area. We have 6 surgeons who perform hundreds of joint replacements each year. We're involved in research aimed at investigating the optimal clinical management of patients having knee or hip replacement surgery. We pride ourselves on our excellent standard of care, great patient satisfaction and low infection rates. Whether you're having a hip or knee replacement, the pre-operative process is the same. All joint replacement patients will attend a pre-operative education class which helps you to prepare for your surgery. The physiotherapist will discuss the rehabilitation process, including pre-operative exercises, which helps to strengthen your muscles prior to surgery.
Your operated leg, so your left leg, and then you'll step with your right leg.
The physio will also demonstrate how to use the crutches.
So your crutches, then your operated leg. Excellent. Keep going.
This is what a normal hip looks like, okay?
The nurse will explain the pre-admission process and how you'll be given an operation date, usually 2 to 6 weeks following your pre-admission clinic appointment.
You need to have your x-rays and your blood tests here today, and we will get your results.
The nurse will also discuss possible complications and how you can prevent them, as well as how long you'll be in hospital for.
Occupational therapists normally look at how you do your everyday activities and what we can do to make it.
Occupational therapists can recommend equipment or modifications to your home to assist you. They can also train you on different ways to manage everyday tasks. After hip surgery, you need to follow hip precautions to prevent injuring your hip muscles. In general, you need to avoid bending your hip past 90 degrees, twisting your leg inwards or outwards, twisting your upper body, or crossing your legs.
Our social work role here at the hospital is in orthopaedics. We work very closely with the nursing staff, with physiotherapy, occupational.
Also at the education class, the social worker will discuss the services available to you that may be helpful when you go home.
And we can also provide you with some support. Sometimes people can get quite nervous and stressed about having to...
For some people, the need for surgery can raise feelings of anxiety or concerns about adjusting to different levels of functioning.
So if you do live alone, just to think about how you may manage when you go home.
Following the education class, you'll go to pathology for blood and urine tests in preparation for surgery.
But when I call, you take a deep breath in and hold your breath, please.
Then it's on to radiology for a
Breathe
chest
normally.
x-ray
Just reduce
to ensure your lungs are
breath.
clear for
Yeah.
anaesthetic.
You stay still.
You'll also have an x-ray of the joint to be operated on. In order to ensure you are fit for your surgery, you'll attend a pre-admission clinic. Part of the success of your surgery depends on how fit you are before your surgery.
Bob Harrison's my name, and I'm looking for, I believe, the pre-admission clinic.
Okay, if you just like to go through the double doors,
Double doors.
turn to your left, and it's on the left-hand side.
That's the clinic, isn't
That's
it?
the pre-admission clinic.
Okay.
That's what I'm looking
Yes,
forward to.
okay, through the double doors.
Double door.
Turn left.
Thank you very
Okay,
much.
thank
very
you.
much.
Thank you.
So your daughter dropped you off.
Yes, she did.
That's
she had
handy.
to go away.
As you enter the hospital, and in each ward and clinic area, there's a hand hygiene station. Please ensure you wash your hands with the wash provided.
Hello, how are you?
Hello.
How
not
can I
too
help
bad.
you?
I'm here for the pre-admission clinic.
And your name?
Patricia Williams.
Patricia Williams. Okay, no worries. Just have a seat for me in the waiting room. I won't be long.
Thank you.
Hello.
How you doing?
Good, thanks. And
Bob
your name?
Harrison.
Bob Harrison.
That's right.
Okay, no worries. Just have a seat for me in the waiting room. I won't be long.
The other way?
Thank you.
See the clerk at the desk when you arrive. You'll be asked to take a seat until your name is called.
Mr. Harrison? Mr. Harrison? Hi, would you like to come with me, please?
When you are called, you'll have an ECG to check your heart. Another nurse will take your blood pressure. She'll also take swabs from your nose and groin.
There you are, Patricia. That's to get your body wash.
You'll need to wash with the antiseptic wash from your neck to your toes every day for 3 days prior to your operation. You or your family should pay at the cashier in the main foyer and collect the antiseptic from the pre-admissions clerk. You must also bring a list of all your medications so that the doctor can determine if any of your medications need to be stopped prior to your surgery. You'll be given instructions on when to stop medications if required. The registrar will view your x-rays and answer any questions you may have about your surgery. He'll also examine your skin. Skin complaints such as eczema, psoriasis, rashes or ulcers can cause infections after the operation. Your surgery may need to be delayed if you develop a skin condition prior to the operation.
I'm the anaesthetist, Dr.
Having seen the results of your earlier tests, the anaesthetist will ensure you are well enough for an anaesthetic. The anaesthetist will discuss the different kinds of anaesthetic with you and whether you're suitable for general anaesthetic or spinal anaesthetic. Patients who are having knee or hip replacement will receive a phone call and a letter confirming their operation date. You'll need to ring the day before your surgery to confirm what time to come into the hospital. You may need to arrive as early as 6:30 if your surgery is scheduled for the morning.
Hello.
Hello, darling. It's Mum. I'm just ringing to tell you that I got the letter from the hospital.
Now is the
club.
time to arrange transport to and from the hospital and the support equipment you'll need, such as toilet aids and shower chairs.
Yeah, that's fine.
It's also time to arrange any community services you may need, such as alternative transport, meals, and domestic assistance. On the day of your operation, you may bring a relative or friend with you. You'll usually go to the pre-admission clinic unless you're scheduled for early surgery, in which case someone will meet you in the foyer.
Mr. Harrison?
A hospital volunteer or the ward clerk will take you to the orthopaedic ward.
Okay, ready? Follow me.
All staff, visitors and new patients to the ward are asked to wash their hands before entering to minimise the risk of infection in the hospital. Here, you'll be greeted by the nursing staff and shown to your room.
Good morning, ladies and gentlemen. Welcome to Ward 2B. Nurses are here ready to take you to your beds, and we'll be with you very soon.
Visiting hours while in this ward are between 10 a.m. and 1:30 p.m, then 3 p.m. and 8 p.m. Please note that no glass vases are allowed in the wards, and no flowers may be taken into the acute post-operative unit or APU. One of the nurses who'll be looking after you will orientate you to your room and show you how to use the facilities on the nurse call
Yellow
system.
buttons for the light.
Through this door here we have the toilet.
Okay, yes, thank
And
you.
over on the opposite side is the shower.
Right.
Marie.
Hello, Bob. I'd like you to get changed. I'd like you to pop this gown on with the opening down the back, nothing on underneath.
Okay.
And do you have any allergies to anything?
No, I haven't.
Okay, then you need to wear the blue hat.
Blue.
So if you could pop those on for me, and I'll
Sure.
be back in a few moments to finish your admission.
Okay, thank
Okay.
you.
Just checking your blood pressure.
Okay.
Once you're settled, the nurse will take your blood pressure, temperature and measure your blood
Bob, I'm gonna
oxygen
pop these
level.
white socks on you. As you know, we use these to prevent blood clots. When you've had
Wearing
surgery.
compression stockings is very important to reduce the risk of blood clotting.
Pop your leg up for me.
This goes on now, but how long do I have to keep it on?
You leave these socks on for 6 weeks.
6 weeks.
Just while you're not as mobile,
Right.
okay? And we make sure they're nice and straight, not folded over, not wrinkled. And the top's left straight up like that and off. Okay?
Okay. Right.
Okay, Bob, we're just going to go through your theatre checklist with you.
Okay.
So what side are you having operated on today?
The nurse will ask you a series of questions from the theatre checklist as an added precaution to ensure that you're the right person for the right operation.
Hello, my name's Christine. How are you?
I'm fine.
You'll be
Yes,
asked
helping
these
with
questions
the
again when you go into
you
the
tell me your
operating
name?
theatres.
Okay, Patricia. What operation are we doing for you today?
I'm having a knee replacement.
A knee replacement? Which side?
Right knee?
Right side? Okay. Are you allergic to anything, Patricia?
No, I'm not.
Last time you had something to eat and drink.
I had a cup of tea before I went to bed last night.
Okay, so nothing today?
No.
Do you have any dentures or loose teeth?
I've got partial denture.
Okay, any jewellery?
No.
Okay, I'll just have a look at your armband. Patricia Williams. Okay, I'm just going to show you your consent. So we're having a right turtle knee replacement. Is that your signature?
Yes, it is.
Okay, so I'll just take you in now.
This is the
In the
transparent
theatre,
oxygen
the
mask I was
anaesthetist will
telling
put
you
an
about.
oxygen mask
I'm
on
just
you.
going to hold it lightly on your face, okay? You just need to take some nice gentle breaths in and out.
While you're in surgery, your family and friends can go to the hospital cafeteria or visit the cafes and other facilities at the local shopping centre. After the operation, you'll be wheeled to the recovery ward, where the staff will monitor you until you wake up. Most people don't remember much about the recovery ward. You'll have a drip to give you fluids and an oxygen mask. This will be changed to a small nasal tube when you wake up.
Okay, I'm just going to check your blood pressure.
Patients are often taken to the acute post-operative unit, where they stay for a day or
I'm having a
two.
look at your leg and your foot here.
You'll have a drain to help minimise blood collection around your new joint, and a urinary catheter. These will gradually be removed over the next couple of days. After surgery, the operation site will be significantly painful. You'll be able to control your pain with the use of the patient-controlled analgesia, or PCA. Adequate pain relief helps you to recover faster.
Okay, I'm going to pop the calf compressors on your legs.
While you're in bed, you'll have calf compressors applied to your legs. This is to help with circulation and prevent blood clots from forming. A large pillow will be placed between your legs to prevent you from dislocating your hip while you're in bed.
Hi, Sue, did you call me this morning?
I did, Eileen. How are you? Are you going to be reviewing the patients this morning?
Oh, yeah, I'll come.
Hello, Bob. My name's Danella. I'm one of the physios that's going to be looking after you.
Hello.
How are you feeling today?
think I'm all right.
Yeah? What we're going to do is sit on the side of the bed, stand up with this frame, and then sit in this chair. Okay?
Well, now.
Yeah, now. Okay, we're going to take this out from between your legs. Can you just move your right leg just across a fraction? That's it. Now, if you want to start slowly moving your left leg over. Okay, keep moving that left
The
leg off.
physiotherapist will assist you to get out of
That's
bed
it, keep
and sit in the chair using a
It'll be little
walking
bit
frame
sore.
for support.
Okay, now try and push with this hand to sit yourself up. That's it. Excellent, that's it. Now, I've got some socks to put on here. These will just stop your legs from feet from slipping. When we're going to stand up, we'll do it on a count of 3. Okay. You just want to bring your hands in next to you. That's it. And then on 3, we're going to stand up. 1, 2, 3. That's it. Excellent. Okay, now we're going to take some little steps to turn around and sit on this chair. That's it. Yep. Nice and slow. That's it. And the other one. And then just let that left leg come out. That's it. And sitting down. Excellent. Lifting
You'll
your
be shown
left leg up
exercises
so
to improve your hip range of motion,
That's it.
as well as breathing exercises to keep your lungs clear after the anaesthetic.
Just try having a cough for me. Can you try having a cough? That's it. Good cough. Excellent. The brow.
Over the next few days, you'll continue to exercise daily to improve your hip range of motion.
Crutches really soon.
Your physiotherapist will assist you with your mobility to progress you onto crutches in preparation for discharge.
Excellent. Keep going. Not much further to go.
When you begin using the crutches, you'll probably find it most comfortable to move your crutches forward together first, and then bring your operated leg to the level of your crutches, followed by your unoperated leg.
Well done.
In the ward gym, you'll practice on the steps with your crutches to give you more confidence once you're up and about. To go up, place your unoperated leg, or good leg, up the step first, followed by your operated leg, and lastly your crutches.
Excellent.
To go down the steps, you should reverse the sequence.
So crutches.
Place your
then
crutches down the step
operated
first,
leg, so the left
then your
leg,
operated
that's
leg,
it, and then your good leg.
or
That's
sore
it.
leg,
Excellent.
followed by your unoperated leg.
Then your operated leg.
Okay, we've also got the long-handled shoehorn.
During your stay in
You can
hospital,
actually use that to
the
hold
occupational
your shoe in
therapist
place and
will
it helps
recommend
slide.
equipment to improve your safety and independence once you return home.
But this is actually a soft one.
The occupational therapist will explain how the hip precautions you'll follow will affect how you manage your everyday activities, such as sitting, lifting, getting in and out of bed and cars, and positioning yourself in bed.
That and make sure that you actually remember the maintenance.
You might be followed up by a social worker to discuss any services or supports you may need to manage everyday tasks, especially if you live alone or have been having
Number of
difficulties.
different appointments and things that they can
Okay,
help.
Bob, here's your letter for your specialist, Dr. Darby.
Following your hip
Appointments down there on the
replacement,
bottom.
you'll be in hospital for about 3 to 5 days. You'll be discharged when you're medically fit, and the physio has assessed your mobility and is happy that you'll be able to manage at home.
Okay, you need to go and have an X-ray.
You'll need to wear your stockings for 6 weeks after your operation, day and night. The nurse will give you your appointments and discharge summary for your surgeon and your GP.
Go and have an X-ray.
The GP may remove your stitches or staples 14 days after your surgery.
Now we give you 5 days worth of
The
medication.
nurse will also give you your medications, scripts, and a spare dressing.
That's it, huh?
That is it. Wow, all the best.
No problem. Take care of yourself. See you.
I've got 2 scripts I saw there, so just give me a tingle and I'll pop down.
It is
and get that fixed
important
up for
to
you.
keep your pain to a minimum so you can continue your exercises at home.
How you doing, Bob?
If you show any signs of redness, swelling, pain, or discharge around your wound, see your GP immediately. It's important to continue your exercises once you're home. Walking is good exercise, and using the stairs will help strengthen the muscles around your hip. You'll attend physiotherapy after being discharged home, and the therapist will assist you to progress your exercise program and mobility to enable you to return to normal function. When getting into a car, slide the front passenger seat as far back as possible and recline the backrest. Remember to take small steps when turning, and before you sit, make sure you can feel the edge of the car behind you. Hold onto fixed areas, like the back of the car seat, and never hold onto the car door, as this may swing and make you unsteady. Driving is not recommended for around 6 weeks after surgery. Your surgeon will confirm when it's safe for you to resume driving. You'll have another X-ray taken before you go to see your surgeon after 6 weeks.
Hello, Bob. Welcome back.
It's good to be back.
You had your hip replacement now about 6 weeks ago.
It's full 6 weeks, yeah.
And how's it going?
I think pretty well. I'm seem to be coping.
At 6 weeks, you may still require the use of a crutch or walking stick and continue to attend outpatient physiotherapy. Once discharged from outpatient therapy, it's important for you to maintain an active lifestyle.
Hip replacement, physiotherapy.
A few months after his surgery, Bob is able to resume the active lifestyle that he used to enjoy. Joint replacement surgery will also contribute to his general health by allowing him to be more physically active for longer.